Welcome to this episode of the Disease Du Jour podcast on the topic of equine lab tests with Dr. Toby Pinn-Woodcock of Cornell University. I'm your host, Kim Brown, publisher of Equine Management. The Disease Du Jour podcast is brought to you in 2022 by Merck Animal Health. Pinn-Woodcock, DVM, DACVIM, large animal, is an assistant clinical professor in the Department of Population, Medical, and Diagnostic Sciences at Cornell University's College of Veterinary Medicine. She received her DVM from the University of Wisconsin, and she did her internal medicine residency at Cornell. Thank you for joining us today, Dr. Pinn-Woodcock.
Well, thank you so much for having me. I'm happy to be here.
Well, we're really looking forward to this because all veterinarians use lab tests to help them make diagnoses or help them determine the best treatments for their patients and to follow up case progress. So let's talk a little bit about, what do you suggest when you're talking to veterinarians about where do they start when they're even trying to decide what tests that they need to submit to you?
Yeah, that's a good question. So we always start by reviewing the history. We like to think about, has the horse traveled? What are the clinical signs? What did you find on your physical exam? And, what tests have you already run? What are the results of those tests? And then from there, we can hopefully formulate a differential list. Once we've got our differential list, I can help narrow down, for these various differentials, I recommend these specific tests, and here are the samples that you need. So hopefully we can get that far, and they can head out and collect those samples and go from there.
So it's really a partnership. So you're recommending that the veterinarians, when they have these cases, that, if they're thinking about, what are the differential diagnoses or which tests, it's okay to call their lab, whether it's Cornell or a different lab.
Absolutely. A lot of labs now have consulting veterinarians. Here at Cornell, we have 3 consulting veterinarians. One of us is always on call to answer our client questions through email or phone call. So yes, and we encourage our vets to reach out because the better guidance they receive from us before their samples go in the mail or even before they collect their samples, likely the better sample quality we receive, the right sample with the appropriate test and the better quality of the results they get. So yeah, that guidance can be really crucial.
Well, that's good to know. And that's a good tip is you don't have to go blind. You can call in and talk to these experts who, are working with diagnoses by using these tests and can really help you with that. So let's say that, you're going through your differential diagnoses and you're trying to make sure you're collecting the right specimens. So what about the handling of those specimens? I mean, that's very critical.
For sure. Sample handling can make or break your ability to use that sample once it arrives to the lab for the test that you've requested. For example, certain types of culture should stay at room temperature. They shouldn't be refrigerated. Other samples need to be frozen in order for whatever we're measuring not to deteriorate on its way between the patient and arriving to the lab. And other samples absolutely cannot be frozen or we won't be able to give you a result. So most labs have a test and fee catalog online where you can look and try to see, what's the appropriate sample handling for this test? I encourage everyone, especially if you're requesting a test for the first time or just can't quite remember, try to, familiarize yourself before sticking it in the mail. And then that's another important piece, that delay from, when you collect your sample to when it gets to the lab. Some sample types and tests, it's okay for that sample to sit in the refrigerator for a few days over a weekend or over a holiday or whatever the case may be. Whereas for other tests, how you handle the sample between, when you collect it and when it gets to us, having a short turnaround time really makes a difference. So you're right. Yep. Sample handling will have a direct impact on the quality of results that the lab can provide.
And when you're talking about, making the right decisions for which tests to do, and that it's okay to make sure and call your diagnostic lab and talk to the folks there. So what kind of history are we looking for? If you're a consulting person with a vet in the field, and they say, let's say we've got some common diagnostic workups. Let's start with fever of unknown origin. So what would you might recommend?
Yeah, fever of unknown origin is a very common presentation in the horse, and we're describing the horse that presents to its owner or manager just ain't doing right. ADR, we sometimes say, they notice the horse just isn't eating with its normal appetite, didn't finish its hay, seems dull, not as interactive as usual, laying down a little bit more, lethargic, and has a fever. So there's not necessarily a leading clinical sign. The horse isn't obviously neurologic. Doesn't have obvious respiratory signs. It doesn't necessarily have diarrhea or colic per se. It's just not acting right and has a fever. So this could be any number of things. And we need to consider respiratory pathogens, GI pathogens, amongst others. So we need to be all-encompassing, considering diseases such as equine herpes virus. The first sign is a fever. The horse may not have obvious clinical signs. Other diseases that we see commonly presenting this way would be Potomac horse fever. Anaplasma phagocytophilum is another one. Let's see what else. Strangles even, when you have a really astute owner or barn manager, whoever's taking care of the horse, sometimes they notice very quickly that the horse is off before there's a real leading clinical sign, and then they call you out to the farm. And maybe your physical exam doesn't help you really zero in on a body system. So then you have to kind of think big. And in that situation, I would collect kind of a plethora of samples that don't require any invasive diagnostics. So you can grab fresh manure and hold that refrigerated. I mentioned Potomac horse fever, but another test that we can run on manure is equine beta coronavirus is a common fever of unknown origin cause. We run that test on manure. You should collect a nasal swab or nasopharyngeal wash to cover your bases for all the various respiratory pathogens. So I mentioned equine herpes virus, types 1 and 4, equine influenza, we have adenovirus, rhinitis virus, just to name a couple. And then in our area, we see anaplasma phagocytophilum, which is tick-borne. And that's a test on EDTA whole blood. So grab a purple top EDTA whole blood tube. Always good to grab a serum sample. As I mentioned, a nasal swab or a nasopharyngeal wash to cover your respiratory bases, and a manure sample. I mean, those samples are going to cover a lot of will allow you the ability to run a lot of different diagnostics.
Well, that's a great tip. And that's, one stop. While you're there seeing the horse, you can do those very simply and have those sent in. And that's a great tip for vets in the field. Let's look at one. Let's pull down a little bit. What if you come in and the horse is showing some respiratory signs, but still not anything specific? The vet calls and says, okay, so I've got this horse showing a little bit of respiratory signs, maybe a little snotty nose, sounds a little funny, off feed, whatever. So what are you going to talk to the veterinarian about? Yeah,
so again, I think that goes back to that list of respiratory pathogens that we just considered. Even if the horse doesn't have a fever, I would still consider infectious pathogens, bearing in mind that we see horses with equine asthma, of course, presenting, with respiratory signs too. So hopefully your physical exam and kind of talking through the history with that owner will help you decipher whether you think it's infectious versus otherwise, because you're going to head down kind of two different paths there. But we'll focus more on the infectious side of things. So for most of your respiratory pathogens, a nasal swab or nasopharyngeal wash will allow you to run PCR for a lot of those pathogens. It's important, crucial to remember not to stick that swab into bacterial transport media if you're planning to run PCR, because some labs will reject your sample. So when in doubt, take two samples, a swab that you put into just a plain non-additive tube with a little bit of saline, so you can run PCR on that. And then a swab that you've inoculated maybe into aerobic bacterial transport media. And the main test that you would run on that would be strep equi culture. We can also do strep equi PCR on your sample that's not in transport media, but sometimes you want to do both. So just to reiterate the pathogens we'd be considering: EHV 1 and 4, equine influenza, equine rhinitis virus, equine adenovirus. We've been hearing more and more about EHV 2 being a player in respiratory disease in horses, so you probably want to consider that as well. And of course, this is not an all-encompassing list. There may be other things to consider. So that covers a lot. We could spend an hour talking about strangles diagnostics. So that will require more time on a different podcast, I think.
And we may come back and do that, because strangles has become quite a acknowledged player around the country these days. We're seeing more and more cases being reported. There may have been the cases in the past, but now they're reported, so owners are paying more attention.
Yes, and I should add that for herpes testing, horses both shed nasally and they can be viremic, so you can have virus in the blood. Whenever you're doing diagnostics for herpes, it's a good idea to get both a nasal swab for PCR and an EDTA whole blood sample, so that we can run PCR on both samples and give you a better chance of making a diagnosis.
Okay, that's a good tip. Work on your summer scan. Enter for the chance to win a Global Pocket Reader Plus in Merck Animal Health's Sizzlin' Summer Sweepstakes giveaway. The Global Pocket Reader Plus is an ISO-compliant universal microchip scanner for horses. It is able to read and store up to 3,000 unique microchip identification numbers and displays and stores microchip temperatures when reading biothermo microchips. Enter before August 31, 2022 by going to www.merck-health-species/equine/summer-sweepstakes. And let's go to the favorite of all veterinarians, diarrhea. So you have a horse that comes up with diarrhea, and it can be, oh my gosh, how many different things can cause this? And what do you do?
Yeah, so the age, the signalment of your patient is going to sort of lead you down some different paths there. I would say, foals versus like yearlings and then adults, they can have different pathogens to consider. Adult horses, some of the pathogens, acute onset diarrhea, you're probably thinking a little bit about their husbandry. Have they traveled? Do they live in a boarding facility? And also just not forgetting to consider things that are both infectious and non-infectious. So we can do floats to look for sand, depending on what part of the country you're in. Sand enteropathies might be more or less common. Parasitism, some of the more arid parts of the country, you may or may not be considering parasites on your differential list, like, for example, cyathostomiasis. But I would say what we're usually wanting to rule out would include Salmonella, Clostridium difficile, potentially Clostridium perfringens, coronavirus, so equine beta coronavirus, Potomac horse fever, and then that would be kind of your adult horse. In your yearling, weanling age, really, you're really wanting to make sure you add Lawsonia to that differential, Lawsonia intracellularis. And then if it's a full, the list really changes, of course, and we have considerations for rotavirus, both types A and B. There's been more discussion about rotavirus type B, which has been diagnosed in Kentucky last year. So that's on our radars now. And other causes of neonatal diarrhea like septicemia, of course, needs to be there too. And there may be toxins in different parts of the country. So you need to just also think about your local environment. And sample-wise, you can't really go wrong if you collect, a fresh fecal sample that you hold refrigerated, a swab of feces that you put in transport media, and clostridial testing can be tricky. You need to remember that the toxins are heat labile, so you need to make sure you grab a really fresh sample of feces and then chill it very quickly so that you can preserve those toxins if you're going to do toxin testing. Labs use different tests for different pathogens. So depending on what lab you send to, you'll want to, pay attention to that. There are PCR panels out there for Clostridium versus culture or toxin testing is one example. And then for Potomac horse fever testing, that's a test that can actually be run PCR on either EDTA whole blood or feces. So again, you want to check in with your lab and see what their preferred sample is. So I think hopefully I've covered most of the differentials there.
Those are great. Those some great tips in there. And again, I want to go back and reiterate this again. So it's not uncommon when you have vague clinical signs and you don't get leads on what to look for. It's okay to call your lab and say, here's what I've got. Here's the background, because it may key you in because you may have been seeing something else from that area or that region that's been that maybe the veterinarian doesn't know about. You might suggest, oh, well, we've had quite a few clostridial cases, so maybe we should pull this test.
Yeah, so absolutely, regionally pathogens vary and seasonally pathogens vary. Like beta coronavirus, we tend to see that in the wintertime and less so in the summer. So when a horse presents with colitis in the summer, it's lower on our list here in the Northeast where I am, but it's not off the list entirely. And so, yes, absolutely. Talk to your lab. They'll probably have some insight for you.
Okay. And I just wanted to ask about Cornell specifically. I know when you and I had talked before we started the podcast, that there is actually some plans that you offer by species, including an equine. Could you explain that a little bit and what that might mean to veterinarians who would use the Cornell lab?
Yeah, and this tool that we offer here at the Cornell Animal Health Diagnostic Center is a tool that could be used by veterinarians submitting to any lab. It's a great brainstorming tool. So we offer, as you mentioned, these are diagnostic plans by species, and equine is amongst them. We have plans that address diarrhea, respiratory, neurologic, weight loss, ill thrift, fever of unknown origin, just to name a few, and there are others. Abortion is another great plan. And so these are what we say a la carte, meaning a list of tests and the specific specimens you need to collect and how to handle them for that disease process. And you just go to our website. You can scroll down to the bottom of the page. You'll see a grid of species there. Click on the horse, and you'll find all of our plans. They're printable, and a la carte means that you don't have to order every test in the plan. We are just trying to tell you, here's all the things that we would consider with this particular clinical presentation. And then you have to use your own insight and knowledge of the case to narrow it down, or give us a call, and we can help you narrow it down. And some of these plans are broken down by, age group or acute versus chronic. So acute diarrhea in an adult horse versus chronic diarrhea, we would consider different diagnostics. Same for respiratory. We have neurologic plans, equine neurologic plans that are blood only, because a lot of practitioners in the field don't necessarily feel comfortable collecting CSF, or the horse can't be referred and they have to just do what they can with the samples available to them. So we try to make them, practitioner friendly.
Well, and that's really great. And I want to ask this. So where should vets go to submit their samples? I mean, with the shipping that we have available today, it doesn't really limit us. We have to ship to the one that's, just 15 miles away, correct?
Yeah, that's true. Some states might offer, discounts for testing, for animals within their state, maybe with infectious, with an infectious disease concern, they may offer a subsidy program. For example, New York State does. So that would maybe be one reason to consider using your local lab if they do offer discounted pricing for in-state submissions. But you can send your samples anywhere, making sure that they're getting to that lab in a timely manner. And as you mentioned, with shipping today, you can get an overnight delivery label and get it there quickly. So some labs do specialize in different types of testing. So you might need to shop around that way. And, even when you send samples to your local lab, if they don't offer a test, sometimes they're referring your samples on. One thing to note is there is a kind of American Veterinary Diagnostic Laboratories accreditation. And so, those labs, they have quality assurances in place, and they're, of course, performing to a certain level of excellence and quality assurance. So sending your samples to AAVLD accredited labs is recommended whenever possible.
Okay, well, that's great. Is there anything else? I mean, I know we have covered things that could take a week to talk about, or a month or a year, just on an individual topic. Is there anything else, though, that you wanted to add just in general to these veterinarians in the field?
I would say I've been there, and I recognize that sometimes you don't know until you get to a call what you're dealing with. And you may not know what tests you need to run specifically. So it's good to have like a minimum database of samples that you should collect from kind of any horse, so that you have the opportunity to run a variety of tests. And you should put those samples into a variety of container types, so that doesn't limit you either. So mainly it's the samples that I mentioned for that fever of unknown origin panel. So it's always good to get a red top tube of blood, a purple top tube of blood, a fecal sample just in a sterile leak-proof container, when appropriate, a nasal swab or nasopharyngeal wash that you put, again, not into necessarily bacterial transport media, but also into a non-additive sterile tube, like a white top or a red top tube. Those samples are going to get you pretty far in your diagnostic workup. For common tests that we run, such as like serology testing on serum, so looking for antibodies, your chemistry analysis, CBC, you can do PCR on EDTA whole blood, a variety of tests on feces that, keeping your feces fresh generally is a good plan over freezing them, and then making sure you're overnighting your samples to the lab, so there's not a delay in turnaround time, especially when you are requesting any cultures. And when in doubt, put things in bacterial transport media as well to preserve organisms for as long as possible before they get to the lab.
Well, those are some great tips. And just that last little list that you gave us is probably worth this whole podcast. And I will make sure and put a link in the article that goes with this podcast on equimanagement.com, So if you want to get a direct link to the Cornell plans by species, we can land you on that page so that you can find those for whatever you might be looking for. So I really do thank you, Dr. Pinn-Woodcock, for joining me today on this episode of Disease du Jour. And we thank our listeners for listening to us, and also a big thanks to our sponsor, Merck Animal Health. We invite you to go back and listen to all the episodes of Disease du Jour on your favorite podcast platform. And if you have any questions or suggestions, send an email to me at kbrown, that's the letter K Brown, at equinenetwork.com. The Disease du Jour podcast is a production of the Equine Podcast Network, an entity of the Equine Network, LLC.